Is Elchin Hasanli. I'm a medical SHO at Portsmouth Hospital University NHS Trust. Thank you so much for watching our video presentation on Quality Improvement Project featuring Practice of Clinical Frailty Scale and Prevalence of Inpatient Frailty. My colleague Sangeeta and I, under the guidance of our consultant Dr. Sukhwinder Dikbal, are excited to share the result of our work with you. We conducted this project at Queen Alexandra Hospital, a large teaching hospital in Portsmouth. So you might be wondering, why did we choose to study frailty? What is frailty anyway? Well, before working in NHS, like many other junior doctors, I was less familiar with this concept compared to other common health conditions. However, it caught my attention when I began to see patients repeatedly admitted with severe frailty diagnosis. But what is frailty? Is it a disease? Are all elderly patients frail? Do all patients with multiple comorbidities tend to be frailer? Can we treat it? Well, the answer to these questions are not straightforward. As definition, frailty is a state of increased vulnerability. While it is more common as we age, it's not an inevitable consequence of aging, and not all frail patients will have multiple comorbidities. What characterizes them is low energy, slow walking speed, and reduced strength. Minor illnesses such as flu or urinary tract infections can lead to acute frailty syndrome in frail patients, marked by immobility, delirium, and falls. So can we diagnose frailty? There are actually multiple various frailty assessment tools available to use in outpatient and inpatient care settings. We evaluated one such tool called Clinical Frailty Scale. It's commonly used in our trust. This scale is designed to assess patient baseline condition, not how they are now, but how they were 2 weeks ago, as even healthy young individual with flu may deviate from their baseline. Our aim was to assess and also enhance the use of clinical frailty scale in a large teaching hospital. Additionally, we conducted a preliminary study to establish a prevalence of frailty among our inpatient cohort. We conducted 2 cycles of retrospective data collection, 1 day each in General Internal Medicine Department and Elderly Medicine Department. We also organized a teaching session between 2 cycles within General Internal Medicine Department. We screened total of 600 patients, 300 patients in each cycle, and with 487 of them meeting eligibility criteria. Included patients aged 65 and above, that's elderly people definition by NHS England, and also admitted through medical assessment unit. As you can see here, sex distribution in the first and second cycle were very similar. And our mean age was 84 and 85, 84.6 and 85 in first and second cycle, respectively, and our median age was 86 in both cycles. It's reflecting that we had a high number of samples taken from elderly medicine department. As you can see, they were approximately 60%. We also compared level of frailty and use of clinical frailty practice across 3 different age groups, as detailed on our poster as young old, middle old, and also old age groups. As a result, we had 11% increase in the second cycle for use of frailty scale, or 7% percentage point increase, as you can see here. And also, mainly the increase was in the under 85 age group, thanks to our teaching in General Internal Medicine Department. While the CFS practice remained consistently high for elderly medicine department by 98.6% and 98%. Most of the assessments, 72%, was done in ED and the remainder 28% approximately in MAU. We also evaluated contribution of different teams, and we found FIT team, their frailty interface team. We found them being very effective by assessing especially elderly medicine patients by completing 58% of all assessment. We also explored it further as an inpatient frailty by completing all the CFS assessment for all the patients, and we inpatient for a male and female group, prevalence of inpatient frailty was very similar. When considering different age groups, we found 65 and 74 age group having higher levels of frailty than anticipated. As a conclusion, as our population continues to grow older, we realize the importance of up-to-date frailty teaching for junior doctors who play a significant role in the NHS. And we also know as a doctor, we cannot provide all the care in the hospital. So it's important to collaborate with specialized team like FIT team who can help us to manage frailty effectively. They are based in ED and MAU in our trust, and they work very closely with elderly medicine department. When it comes to 65-74 age group and their frailty, our sample size was small, but it emphasizes early identification of frailty in this group, because the people with unrecognized frailty are at the risk of rapid decline. We also want to see larger studies to be done in this age group in acute settings in the future. At the end, I would like to emphasize two important points as key takeaways from our project for junior doctors. First of all, 85 and above age group, our data shows that 90% of them are frail. So it's important to focus on monitoring their frailty status, especially during long admission, and focus on their future care as well to make sure we can provide a safe discharge for them and also reduce readmission in that group to improve quality of life for them. Second group is 65-84 or 65-74 group as an overlooked group. They are frailer than we think. So it is very important to improve CFS practice in that group. And also, how can we do that? So next time, if you see any patient, especially from as a young old or middle old with repeated admission, it's important to ask ourselves, are they frail? It's a very important question to ask because especially clerking in ED, it can affect their treatment escalation plan in that admission. And also it's a very important question to ask when we discharge this patient, especially after long admissions, because they might be off their baseline and they might have a new baseline which can affect their future care plan. Thank you so much for your attention, and feel free to check our poster for more information on our project and comment below if you have any question. Thank you so much and see you in the conference.